technology. So I just hit the start recording button. And let's see if the thing pops up. Okay, it says we're recording. So, Natasha, these ladies would like to join your practice. Why should they?
Yeah, so welcome to our practice. Just wanted to tell you a little bit about sort of our new model of care. So we are transitioning to more of a team-based care model. So what that means to you is you will still have a primary care provider. So you will have your person, your point person, but you will also have other team members that will be familiar with you. So if for some reason, let's say I'm your primary care provider, I am not there today, and you have a need that needs to be met, one of my colleagues will be able to address your need at the moment that you declare you need something. We also have other team members that are not just traditional kind of primary care providers. So if you have other needs, such as medication questions or teaching that needs to happen, we do have a pharmacist on our team. We also want our nurses to be more involved in your care, and also for you to know who they are by name, and to also have a point person that is a nurse. So if you have a question that needs to be answered, a form that needs to be filled out, that you have somebody that you know you can call up, you know them by their first name, and that you can have that need met. We also have additional people on our team, such as case managers. So if you have any questions about cost of prescriptions, food, or if you have any sort of food insecurities, if you have housing issues, insurance issues, they will be able to assist you with that. We also have behavioral health specialists, so they are there to support you if you have any mental health concerns, depression, anxiety, going through a tough time, really just want to talk to somebody. We also have dietitians on our team who are offering both in-person as well as telehealth visits. So if you are wondering about what foods might be right for you, if you have questions regarding your medical problems and what foods might be appropriate, you can certainly set up an appointment with them. And then we also want you to be a little bit more familiar with the other team members that support us. So our front desk support, our medical assistants, our licensed nurses as well. And so when you walk into our office, you'll be able to know who your team is, what their names are, and when you step into the office, you'll feel like people actually know who you are, and be able to answer any questions that you have. So how can I help answer questions about our practice?
Wow, sounds like a great practice. I had no idea that's what you were putting together, Natasha. Can I go first with just a quick?
Please.
Yeah,
please.
go for it.
When you talk about the case managers and the behavioral help, is that all on site that we would get care there?
Yep. Yes, absolutely. So you have both options available to you. So our case managers are sometimes in our office and then sometimes virtual, and they can certainly meet you in the office if you have a need, or they can set up a phone visit or kind of check in on you depending on your need. In terms of our behavioral health specialists, absolutely. So current state, we have a therapist who works sometimes in person. So if you prefer to actually meet in the room with them, you can do that. Some people really like the idea of talking to somebody on the phone or over video. So we can certainly arrange that as well, depending on the day. She has certain days that she does video and telephone visits, and then other days she does in person. Eventually, we will be adding additional team members. So we'll have an embedded psychiatrist as well as an additional therapist. And I imagine that their schedule will be somewhat similar in terms of having the option of doing in-person or telehealth.
And we're hoping I could get in within a week or two, because my experience is I'm talking to the provider. I'm like, you're right, I should see somebody. And then they tell me 3 weeks out and I've lost all momentum, right?
Absolutely. Yeah, especially around mental health. You know, there's just a lack of mental health practitioners in the state for that matter. And so that was one of the reasons why we wanted to bring them in-house so that we would have more access to them. So we have kind of two sets of behavioral health resources for you. So our first resource is through our community health team. So they're offering short-term counseling. So typically anywhere between 3 and 5 sessions. So the wait time for them is actually pretty short because their patients are kind of constantly changing because they're doing those short-term sessions. The other behavioral health specialists that I talked about, the psychiatrists and the other therapists that we'll be adding, will do longer-term kind of indefinite care depending on what your needs are. And the goal is to have, in an ideal state, some kind of on-demand service. So let's say you come and see me in the office, you tell me that you're really struggling with depression and that you'd like to speak with somebody. My goal would be eventually that I could just kind of walk down the hall, grab our behavioral health specialist, at least do a warm handoff. They may not be able to see you right in that moment. Sometimes they can, sometimes they can't, but at least you've kind of made that connection. And I think that's a really powerful experience, especially if you're kind of hesitant around therapy. Having them come in the room can be really helpful.
Yeah. And is that part of the CHT of Port? Like it's covered?
Yeah. So current state, our therapists are part of our community health team. So that means it's free of charge to all of our patients. So our dietitians are free of charge. Our therapists are free of charge. When we add the embedded mental health team, so the psychiatrists and the additional kind of longer term therapists, that will be charged through insurance.
Okay. And then just following on that, when I've gone in and my insurance is not so great, I have insurance, but it's not so great. I'm not always offered the financial paperwork, even though I know that it could apply to me, but I don't think staff knows, like, oh, you have insurance, you're fine. Is there somebody there that would be able to sit down with me, because it is so overwhelming to fill that out, and I am capable, and so I would like to think whether it's yes,
absolutely,
to say, let's sit down, Sarah, and let's fill this out, whether I have insurance or not. So that's kind of 2 parts.
Yep. Yeah, so so if we're talking about sort of general insurance questions, our care managers absolutely can do that. So they do that all the time for our patients. So whether that's kind of sitting down in the office with the paperwork together, making sure you can kind of understand it and know where to sign, or they can do it over the phone if it's something a little bit less complex. When it comes to insurance questions around medication, that's where our pharmacist will be really helpful. So he just started this week, but already he's interacted with patients where, you know, I prescribe a medication, it's either the copay is too much or it's not covered by insurance. So he's able to kind of then sit down with you and kind of understand your insurance and make sure that I'm prescribing a medication that your insurance will cover, or there'll be less of a copay for you. And an example of yesterday, actually, I wanted to prescribe a medication for a patient, and before I even did, he was able to check the insurance, and I was able to tell the patient exactly what the cost would be to them.
That's a huge service to people.
Yeah.
Okay, Ginny, I'll give you a moment to talk if you want. I got all sorts of.
I love it.
You're doing amazing, Sarah.
You're doing great, Sarah.
All right.
Okay, so I'm new to the area, and I'm 66 years old, almost 67 years old, and I heard that people who study gerontology, their patients do better in the long run, that they're healthier and they live longer and they're more independent. So do you have someone who attends to older people on your staff?
So when you say gerontologist, I think what that means to me is an internal medicine provider who's then done an additional fellowship in geriatric medicine. Those trained professionals are few and far between. So if we're talking about sort of our network resources, on our Burlington campus, there is an office that does have geriatricians, and certainly there is a ton of value that they can bring. We do have access to them, so if we have questions or concerns or something that's very specific to their expertise, we can certainly reach out to them. We also do have a family medicine provider who exclusively works at our nursing home. So again, she can certainly provide consultation, but we don't have a specific geriatric trained provider in our office. But we do have family medicine providers as well as internal medicine providers that are well versed in all ages. And in fact, a lot of patients are of the geriatric age. So we do have, although we haven't had sort of a specific fellowship in it, we do have a lot of expertise in that area.
So I would either have to get an appointment up in Burlington, or I'd have to see somebody who generally deals with people who are in a nursing home state and not a healthy, active.
No, the provider that works in our nursing home, she exclusively works in our nursing home. So she doesn't actually see patients in our office. So the providers that see patients in our office are seeing all age spectrums. So, but they have access to her if there was a question that they felt like a higher level of expertise would be needed.
Okay, so when you say providers and practitioners, you gave us a long list of support people, but who am I going to see? Am I going to see a doctor? Am I going to see a physician's assistant? Am I going to see a nurse? Who am I actually going to see and start creating this relationship with?
Yeah, so that point person that I refer to as like your primary care provider, which I'm sure you're probably familiar with, that person can be whoever you choose. So we have a spectrum of training in our practice. So we have doctors, both family medicine and internal medicine doctors. We have nurse practitioners. We have physician assistants. And then depending on what you're coming in for, you may elect to do a different type of provider. So you may elect to actually see a nurse who can spend longer time with you than one of the providers if you want sort of additional education or you have questions. If your problem is regarding a medication or maybe a single kind of chronic illness, you may elect to see our pharmacist who can kind of give you a different perspective. But your main point person and for all of your main questions and kind of your general needs will still be your primary care provider. And you have the autonomy to choose if you want that to be a doctor or a physician assistant or a nurse practitioner.
And if I don't care for the person that's treating me, can I switch?
Absolutely. Yep. We do that all the time. And, we want it to be the right fit. So, you can meet the provider and have a couple visits. And if it doesn't feel like it's the right fit on either end, we certainly encourage you to switch within our practice, or we have other primary care practices that you can elect. We do have a new patient call number. So if you have kind of a specific idea of what kind of provider you want, our new patient call line can help figure that out for you. So you can talk to them and their specialist and kind of matching patients with the right provider based on what they're looking for.
And in the past, specifically when I went to the emergency room, I never saw the physician. I always saw the physician's assistant, and yet I was billed for seeing a physician and not for the physician assistant. So do you do that? Do you bill me for seeing a physician if I'm seeing a physician's assistant?
No, so we bill for whoever you see. The one caveat there is if you see a clinical person that can't bill, so specifically our nursing staff and some services that the pharmacists provide, they may bill under the doctor that supervises them. But if you come in, let's say for a cold and you see one of our physician assistants, they will bill out under them.
And the pharmacist, I can just walk in and get my prescription filled? Or
yes,
will you call it in for me so I'll walk in and it's ready for me?
Yeah, so when you request a prescription, that processes through your primary care provider. So we don't have like a pharmacy on our site, but we do affiliate with the University of Vermont mail-away pharmacy. So if you wanted your prescriptions to be mailed to you, we could certainly get you set up with that. But in terms of just a local prescription that you wanted renewed, you would just request that through the normal mechanism. So whether that's calling, requesting it through your pharmacy, or if you do have portal access, you can request it through that. And then that will be processed by your primary care provider and the prescription will be sent electronically.
And one more question, Sarah, and then I'll throw it back to you. Okay, so I'm in my 80s now, and I feel my body getting tense and tight and whatnot. But I feel like I'm still okay and I still have a lot of energy and strength, but I just feel like I'm losing my flexibility. So do you have a physical therapist that I can see?
Yes, so not in our physical footprint, but actually right behind our primary care Middlebury building, we do have a physical therapist that's part of our Porter community. They're fantastic there. And they really try to get you in as soon as they can. So their wait times are actually quite good. So we can certainly refer you there if you prefer to stay into the Porter community. And there's some great physical therapists within Addison County that we work with. So we could certainly refer you depending on where you live.
Now, recently I was at a lecture and they were talking about senior citizens who do get physical therapy. And there was a study done, and I'm sorry I can't provide the actual source, but there was a study done of people who were about 28 years old and people who were senior citizens who went to a physical therapist for exactly the same issue. And the 20-something-year-old got the full basket of therapy and exercises and recommendations for at-home exercising. And the 80-something-year-olds got maybe 15% of that recommendation. So how am I supposed to stay healthy and flexible if you don't push me?
Yeah, and it would be a great question. I'd probably defer it to the physical therapist, but what I would say in terms of the primary care office, I see us as sort of your health advocate, right? Your partner in health. And so if you feel like you're being referred to a specialist, whether it be a physical therapist or elsewise, and you feel like you're not getting everything that you need, or that you need an advocate, or you need, a primary care provider to physical therapist discussion to kind of discuss goals of care, we are absolutely happy to do that. But, sitting down with your primary care provider and really discussing what your goals of care are, what you're hoping to get out of life, and how we might support you in health would be really important so that we can be your best advocate there.
Okay, thank you. Sarah, it's all yours.
Okay, well, you had talked about the different providers, and I don't remember, Ginny, if you were the one, but will you have a naturopath on site?
We do not currently have a naturopath. So I myself are osteopathic physician. So I definitely have more sort of alternative medicine training. I do a lot of manual hands-on manipulation. We work really closely with alternative practitioners. So there are some naturopath, acupuncturists, and other alternative practitioners in Addison County that I refer a lot of my patients to. So we can certainly get you set up with a naturopath, but we won't have that service right out of the gate.
One of the things I appreciate with a naturopath is the longer visits. You know, when you go in, you're going to have 30 minutes to an hour easily. So even though you don't have a naturopath, will there be is there a feeling of more wellness in that we're going to take the time, talk to you now, and hopefully maybe keep you from getting sick down the road, or help support you? So we're talking a wellness practice, which sounds like you're looking for kind of a one-stop, let's take care of all your needs. Well, part of my need would be, I need to know that when I come in, you're not going to push vaccines on me. And because that's what you're told, yes, they're important and I want them available, but I also want somebody that can talk to me about alternatives and not shun me from that, right? So how do you feel like the vibe or the culture will be in your practice?
Yeah, so I'll take the first part of that, wellness. I mean, that absolutely is the goal, right? So the reason why we're sort of shifting to this model is we want to move away from what I call kind of reactionary crisis management to that more proactive wellness management. So giving you sort of an array of team members that can meet your needs. So, it may be a provider that you spend longer time with, or it may be a nurse that spends an hour with you talking about advanced directives or vaccines, for that matter, if you have questions about it, or you might spend an hour with our dietitian if you really want to focus on nutrition. So depending on what question or issue you have, we could certainly set you up with the right team member for that. In terms of the vibe or how people kind of view alternative medicine, that's really provider by provider specific. So that's where, at the outset, when you join our practice, if you let us know kind of what type of provider you're looking for, we can match you. So for someone who is more interested in alternative medicine or wants a provider who is at least knowledgeable or open to those discussions, they may put you with me, for example, or there's a couple other providers that have that. There are other patients that really like more the traditional approach, which certainly I can, but there are other providers that may be better equipped to kind of do that more traditional approach. But I think at the outset of just kind of as a patient, when you enter our office, having a discussion initially of kind of what your medical goals are, what you think is important, is really helpful for us as the provider to know how we talk to you and what kind of information we give you and how we support you.
Mm-hmm. And what's nice, what it sounds like is this one-stop shopping. If I'm coming in for birth control or a pessary, we get plenty of referrals at Porter Women's Health because they're awesome, but it's also, I'm building a relationship with you guys. I don't want to then be sent off to someone else. Are those options that you'll have at your shop?
Yep, absolutely. So depending on which primary care practice we're talking about, we do have practitioners, I think pretty much at each office that offer women's health. So we have Nexplanon insertions, we have IUD insertions. I don't think we have any providers currently that do pessaries, although that's something that we could probably add in future state, but we definitely have practitioners that are passionate about women's health and have that skill set. And we work really well with our women's health team. So if there is something that is out of our kind of expertise, we do refer you, but then, you come right back to us and we can kind of manage anything after that.
Yeah, what I'm thinking about, you can go to your primary care per insurance usually, and you can go to your OBGYN every year, depending on your insurance. And I find a lot of people will, I don't know, but they're either one or the other. Nobody wants to go to both necessarily.
Right.
And so we're like, well, you come annually to OBGYN because we do all these things in network, but wouldn't it be nice to feel like you could get all your care at one place or the other? Now at OBGYN, you can't get your antibiotics, and sometimes, or if you have a cold, or then you go to your primary. So to be able to establish a one-stop place, including a pessary, because that's really important. And I don't want to come to you all the time and then have to go to OBGYN for my pessary care. So what a valuable, and then OBGYN really becomes more the specialty practice where you're going for ultrasounds or new OB. And not that I want to take away the people from that, but I think there's value in being able to get my IUD changed at 40 and 50 at one stop, because it's what I feel like the practice you're developing can be really valuable throughout your life.
Absolutely.
Yeah. Okay.
Yeah, absolutely. I mean, that women's health is sort of my passion. So I'm one of the providers that does the IUDs and Nexplanon and that kind of thing. And it depends on the training of the providers. We're adding 2 new providers to our primary care Middlebury office, and they both do really full spectrum primary care. And so, there are other providers in the other offices that do that as well. Just, either making sure that we're hiring people that do the full spectrum, or people that have done it in the past and maybe not had as many exposures, just kind of getting them back up to speed or getting them re-educated, I think would be really helpful. But yeah, I agree with your point.
Yeah.
It's really helpful to have the one-stop shopping. And also, especially when we're talking about a procedure like an IUD or an Nexplanon, I think it's a lot nicer for the patient to have their provider do that, because that can be really scary and uncomfortable, and to have it in their medical home with their provider feels like a better experience.
Yeah. As we're talking, I'm realizing a lot of times people will be coming to OBGYN and they don't have a primary, or they do, but they never see them, because once they start seeing us, the primary kind of falls off. It's like, why do I go to my primary unless I have a whatever allergy or prescription? And the problem that I see is we have Porter Women's Health is an amazing practice. We do have a CHT, but we don't have the capacity, we don't have the resources to do everything that these people need. So if we can keep them at their primary care and offer all these different ways of keeping them healthy, then we just use Porter Women's Health is for more that specialty, then we could see a change in the way people look at their primary care, right?
Right,
It's like,
right.
oh no, I have a relationship with my primary care. People do not, at least when they come in. So that's cool. I'm just realizing that, boy, the health of our community could really change too if people knew who their primary care was, but didn't really. Then they don't need to know what their specialty. We'll help them with that, right? But
Right. Right. Yeah, it's definitely about a re-education. I think you could make that argument for a lot of our specialists, right? So one of my hopes and dreams is a lot of the urgent care visits that we see at our express care could be taken back into the primary care, like creating space for more urgent care, or a lot of the orthopedic care, like straightforward knee pain, back pain, shoulder pain. Those are things that primary care providers can absolutely help with, and only if you need surgery or specialty kind of expertise do you then go see them. And so a lot of people, it's just a lack of education, knowing what primary care can actually do. And so that's kind of the power of this, is not only talking about sort of our new model, but what actually is a primary care provider and what can your medical home provide for you?
this is big.
Yeah.
Okay, Jenny.
Yeah. To that point, yeah, I mean, I'm okay. So I'm 50 years old. I have my OBGYN. I have my I don't know, someone who takes care of my rheumatoid arthritis. And I go see my ophthalmologist every year. And who else do I see? So I'm already seeing 3 doctors. Why do I need to come to see you too? I mean, I'm healthy. I'm not on a lot of meds, and what meds I am on, they're taking care of me. So why should I see you?
Yeah, so I think it's twofold. Some of that, some of the things that those doctors might be doing for you are things that we can do, right? So oftentimes I refer to a specialist, they answer a specific question I have, and then I ask the patient to come back to me, and I continue to prescribe the medication and manage it. So it may be, why do you need me? Is kind of, maybe I can actually be those 3 doctors for you, right? And only consult them when need be. The other thing is to kind of go back to our discussion about wellness, right? So those people are reacting to a problem, treating a condition, whereas in primary care, we really want to be proactive and focus on wellness. So when you come to see me for an annual wellness exam, we will probably talk about those chronic illnesses, but the focus will be on nutrition and exercise and vaccines, if that's what you wanted to talk about, and preventative things like cancer screenings and things of that nature. One kind of cool example of this is we're now offering genomic testing. So this is a blood test that you can get that will take your entire genome and map it out. And that gives us information that we can then be proactive about. So, for example, we can find out if you are a carrier that puts you predisposed to cancers. And if you are, we can have a discussion about what additional screenings might we need to do, or do I need to see you more often to try and catch a cancer if it were to occur, so that we can prevent it from being a major problem. So those are some examples of kind of that proactive wellness care that I'm talking about.
So one of the issues I've had with doctors in the past is, other than my primary care physician, and I've had some really great ones in the past, but some not so great ones also. Mm-hmm. But one of the things that drives me crazy is that I tend to seek out someone who's more of like a functional practitioner. Mm-hmm. I want someone, and this goes back to the holistic approach as well. I want someone to see me as an entire person, not mm-hmm. just someone with a specific issue or some issues. So do you have fundamental or functional medicine backgrounds, or how do you approach that?
Yeah, so we don't have, so functional medicine, there, people kind of come to that from different angles. So there are people that kind of do more focused education on functional medicine, and they often come from different kind of diverse backgrounds, different training. So we don't have anyone that has kind of declared that as either their specialty or their special interest. But it's certainly something, if the community is sort of looking for that, we could explore that. I keep talking about myself, so I apologize, but I do think DOs are kind of well equipped to be primary care providers for this angle, right? So the way that osteopathic physicians are taught is more that holistic whole body. So even at the very basic in med school, instead of asking us like disease question after disease question, they tell us about the patient, about their family, and then they ask us the disease question. So they kind of start that mindset from the beginning of like focusing on the person. And I think that's what we're doing with, our team-based care approach, is talking about sort of, who is this person? This is our patient together as a team. This is the person that we are taking care of. It's not just the diabetic over there or the person with heart disease. It's Ginny, right? Like, we know you and we're here to help.
Okay, so when I come in for a physical, an annual physical, what am I going to get? In the past, I would be looked at from head to toe. I'd have my skin looked at to make sure that I didn't have any kind of unusual growths. One doctor did some heart tests to make sure that my heart was healthy. And then recently, the last few physicals I've had, they just walk in and ask, how are you doing? They'll just listen to my heart. They won't look at my skin. And they'll look at my ears, they'll look at my throat, and look at my nose and my eyes, and then they'll send me home. That's not a physical. So what do you do?
Yeah, and I might come out of character for a second to kind of probe on this a little bit. So let me answer it in character and then I'll come out. But so it depends on what type of wellness exam you're coming in for, right? So if we're talking specifically around a Medicare wellness exam, that is an exam slightly dictated by the insurance, right? So there are specific questions and paperwork that we need to complete in order to bill it out as a Medicare wellness. Historically, that's been sort of a very formulaic visit, and that's probably kind of what you've experienced or at least alluding to. What we want to do with the Medicare wellness is obviously check those boxes for the insurance company, but making it a more meaningful experience both for the provider and the patient. And so, having a nurse or a pharmacist augment that experience and spending more time and really diving into, the nutrition and exercise and things of that nature is really what we want to do to round out those visits. In terms of the annual exam, this is where it gets a little bit tricky. So the expectations of patients are wildly different. And that's why I think it's really helpful for when you come into the provider's office to kind of let them know what you're expecting, right? So there are some people that really enjoy that in and out, quick questions, make sure we hit all the things that we need to, and I'm out. There are other people that really want to spend an hour with you kind of talking about their health, getting the head to toe exam. And this is where I'll come out of character for a moment. So the pendulum has swung a little bit in terms of how we think about the physical exam. So historically, doctors were trained to do sort of that really intense bedside physical exam. What we know about that is that there's kind of zero evidence that that prevents anything in the future in terms of cancer or any kind of medical problem. And so the new sort of thinking and teaching is really to do what we call evidence-based medicine. So really doing things, whether it's physical exam, lab test, any of those things, based on something that I know is going to make a difference, right? So I'm not just going to order a bunch of labs to order a bunch of labs. I'm going to order it because I have a question that I need to answer, or that I know the screening has enough evidence to get us an answer that will be able to let me intervene before it gets to be a problem for you. But what it has led to, that kind of new way of thinking, is exactly what you're describing, of people who are used to having that head to toe physical exam, and then they come in, they don't express that that's their desire or their expectation, and then they get kind of the new version, right, where it's very different, and then they leave feeling unsatisfied. And so I'd love for you guys to help us figure out, how do we message that? We've done a couple different things in the past where we've sort of sent patients a letter. It's like a 2 or 3 page letter explaining exactly what should happen in the physical exam and why we ask all those questions and what sort of our expectations are of that. I've also had conversations with patients who've had that experience and saying, that didn't meet my expectations. This is what I wanted. And I've asked them how, what could I have done differently, or what kind of questions could I have asked to elicit that information to understand what your expectations are in the office. So if you guys have thoughts on that, I'd love to hear it.
Do you want them now, or do you want us to continue playing?
I don't know, Ron, can we come out of character for a moment?
Well, actually, why don't we stay on point for this conversation? Because as I listen to this, I'm thinking this actually could be a recording that we might be able to use for other patients and maybe even put on our website. So let's go ahead and continue to have this conversation so that other patients can benefit from these answers. You guys are doing great work.
Sounds good.
Okay, so now I'm transitioning. I'm a 90-year-old woman. I've had throat cancer, and I had my epiglottis removed, and I go into the hospital every year for pneumonia. It hasn't happened except for the last 4 or 5 years. And every year I come out weaker and weaker and weaker. And to prepare for what may happen this coming winter, I'm telling you as my primary care physician that I'm ready to die.
Mhm.
I had a mini stroke. I can't drive anymore. My volunteer time is limited. I'm having a more difficult time doing daily things, although I can still function alone in my house. But there's just no joy anymore, and I'm tired of this. I'm tired of degrading. It's not depression. It's just I know that I'm ready. I know that it's time for me to go. I don't want to fight you on my deathbed.
Mhm.
Are you going to let me go?
Yeah, absolutely. So those are the types of conversations that I really enjoy having with patients to kind of understand where they are in that thought process and to be able to support them. So it's great that you've been able to come to that point and to let me provide you with some resources to support you. So not only is it helpful for me to understand and be able to support you on where you are, the additional services that we can offer you that might be able to support you. So things like palliative medicine, or depending on where you are, hospice medicine can also be really helpful. So those are services that support you in this part of life. And so really respect those goals of care. And if your desire is to not come to the hospital or not even come into the primary care office and just be kept comfortable at home, there's lots of things that I can do as your primary care provider to support that, as well as having additional community resources that may be able to come into your home and help support you there and help support your family as well.
Okay, so as I'm preparing to go, is there anyone on staff who can sit down and help me with my advanced care directives?
Absolutely. So there's a couple different team members that can help you with that. As your primary care provider, I could certainly help you with that. And that's one of the things that we talk about during the wellness exam. Sometimes you need a little bit more in-depth discussion around that. So oftentimes we'll have you meet either with our nurse or our care manager that can spend kind of unlimited time with you, going step by step through that process, and bring any family members in that may want to be part of that discussion. So that's absolutely a service we can offer for you.
Okay, so now I'm a 14-year-old girl, and I'm coming in for the first time to see you, and I'm embarrassed. I mean, I'm uncomfortable about undressing. If you're a male doctor, I'm really embarrassed about undressing in front of you. If you're a female doctor, I might be moderately embarrassed about undressing in front of you. And I don't want you to talk to me about sex. I'm not sexually active, so I don't want you to assume that I am. So why should I come see you?
Yeah, so it's about just kind of checking in and building that relationship, and again, sort of understanding why you want to come to the doctors, what you're hoping to get out of that visit. And there's certainly some questions that we ask just so that we kind of understand what your needs are or how we can support you. But we let you kind of take the visit where it needs to go. So if you're wondering about things or you have questions, this is kind of a safe space to do that. And we often have the parents leave the room for sensitive discussions if that's what the patient desires, so that you feel completely comfortable. And actually, starting at age 11, you actually have access to your medical record and your medical record alone. So you get to decide who has access to that or who doesn't have access to that. And so I can be that point person for you for any medical questions or concerns that you have.
Okay, Sarah, I'll throw it back to you.
So my understanding is you're pediatrician through elderly and dying at your
Correct.
practice.
Yep.
So building a relationship there is really important. I could potentially be coming from a baby to older age.
Mhm.
What is the staff retention? How do you care for your staff, and how do you value your front office so that you aren't having a turnover? Because a lot of practices we see front office staff as a stepping stone to move up or move on. Are you planning on shifting that model so your front office staff is valued in that practice, so they will hopefully feel like a valued part of the team and not have the turnover?
Absolutely. So that is one of the major goals of this team-based care. So when I say team, I'm not just talking about the doctors and the nurse practitioners and PAs. I'm talking about everyone who works in the office. So our goal is that we will have front desk people part of our team that you will know by name, and that you can come in, they'll know who you are, you know their name, and they'll greet you. And we're trying to really elevate their role. So they may actually do more things in terms of patient-facing activities than they currently do. So one of the things that we're exploring and trying to figure out if this would be a value add for everybody is, once I'm done with the visit, what we'd like to do is have our front desk people actually come into the exam room and do the checkout in the exam room. And what we would like them to do is kind of do a summary, like, what questions do you have? Did you get everything answered? How was your experience today? Let me book your follow-up appointment. So really giving them the education to be able to kind of either answer really kind of simple questions that come up from the clinical visit, or at least be able to direct you to the right person or additional resource that you have. So in sort of the true sense of team-based care, what we're thinking about is to actually have what we call pods. So in that pod, there would be 1 to 2 front desk people associated with that pod. So you would always have those people part of your team.
Okay. And as far as the training, so as a transgender person coming in, I know that the questions for the portal all through UVM is, what is your how do you identify? And I don't always get asked those questions. They're awkward. We don't know how to deal with that. We're still learning and educating. How are you going to train your staff so it becomes more comfortable and familiar, and not this taboo thing that I don't feel comfortable asking those weird questions, because I'm just looking at this person and it's a female, so I'm just going to assume. How can we make the culture, is that important to your practice? Because other practices, I'm sure it is important, but it hasn't been executed yet, and I don't feel like there's the training, from my experience, for those people to really just be okay with asking those questions and knowing that all around us people have different experiences.
Yeah, absolutely. I mean, it certainly is something that we are hyper focused on in this moment. And so a couple things have happened. So with our new electronic medical record, we actually have more ability to support patients in that. So in our old medical record, literally we could just choose male or female. With our new medical record, we can have a menu of options or however a patient identifies. We can also list birth names and then preferred names as well, which is not something we could do in our prior medical record. We're also kind of Porter-wide doing sort of an initial sort of information gathering of how patients' experience is at our hospital, whether it's our primary care clinic or elsewhere. And we've made some changes, small at the beginning and certainly hopefully more substantial as we go through, on making it a more welcoming experience. So we actually have a diversity, equity, inclusion group that's really focused on this. Some of the small changes that we made are gender neutral bathrooms. So just this week, actually, we have signs on all of the bathrooms that are gender neutral. We also have been distributing the rainbow flag stickers for anyone who would like to put that either on their laptop, in their exam room, things of that nature. And certainly, some of our staff has had that training that you're referring to, but we certainly need to do more in that. And I think the more patients that come into our office that feel welcome or that would be open enough to kind of give us feedback when we aren't actually meeting their needs or making them feel comfortable is really where we learn and grow. And then having more providers who are open to that as well. And certainly we are adding more staff that has experience in that.
Yeah, that's what I was thinking. Even you're talking providers and stickers and all of that is important, but when I'm somebody, I don't care about, it's important if I walk in and I see a sticker, I'm thinking, okay, these people are open. So that's a sign. Or there's a couple books that talk about, but the staff that's communicating me, that front office, that the first people that I see, and they're not comfortable with it. And then I'm having to say in front of a waiting room who I am or what my financial situation is, and that's awkward. And I wonder if there's a way. We used to fill out paperwork when we went in. It doesn't seem like that's an option now, which is fine. We don't like paperwork, but it does offer a way to be either more private about it to communicate, or I need the front staff to be like, welcome, what's your, how do you identify? Let's talk about this. But if that front person isn't comfortable with me, then so it's great if the provider's getting the training, but what's the trickle down with the top people that are all getting educated? Whoop-de-doo, that's good, but it's the people that I'm talking with right here, checking me in, that I really want to feel like they know me. So
yeah, absolutely. So two answers to that. So we actually were supposed to have a kiosk, a check-in kiosk that was about to roll out like a couple weeks prior to COVID. And so that obviously did not roll out, but that we might actually bring that back. And then if you are a patient on MyChart, so our portal, you can fill out all of that paperwork online. And we also are doing a lot of what we call pre-registration. So we call you beforehand and do a lot of that information gathering on the phone, which patients really like as well. In terms of the training, so we've had in the recent past, we've had one training. So one of our pediatricians who really is passionate about this subject, Dr. Ariel Gallant-Bernstein, actually came over to our primary care Middlebury office, and our entire office, including our front desk staff, got some education and training just on pronouns and how people might want to be approached and things of that nature. So they certainly have heard it and had some training, but one training session doesn't make an expert, right? So it's about sort of continual training, continual reinforcement, and continuing discussion about it.
Yeah, I think there'd be value in actually having somebody that's transgender or has different experiences that could actually come in and talk to a team of people. I think that would be
I agree. That would be awesome.
Just so to help kind of familiarize and normalize a little bit, and that put some ease at talking to somebody that actually could say, oh, that comfort. Are we going to be dealing with a PAC when I call in? Because I don't like when I call into the PAC, I'm put on hold, then I go to the office, then I'm put on hold again. Is PAC going to be part of your practice, the patient?
Yes, so there's certainly opportunity for improvement there in terms of how we actually use our call center. So they really should be an extension of our office, and you as the patient really shouldn't know if that person is physically located in our office or are they physically located in another spot, right? And totally appreciate that that's not current state, but that's where we would ultimately like to go. Where part of this kind of team-based care transition is figuring out what do we do locally, what needs to happen in our office, and then what things can we do virtually or outside of our office, and how do we make that a seamless process for our patients, right? So they really don't know which things we've assigned to where, that it just feels like this is our team, this is your office. So that's an area of opportunity and growth, absolutely, but that's our ultimate goal.
Okay. And then will you have an ultrasound on site? Because there's been times where they're like, oh, I think I see something. And I'm like, ah, and then they're like, now I'm shipping you off to another really awesome practice and we'll make it happen for you. But I'm like, but just tell me right now, because I'm really nervous.
Yeah, so ultrasound, right now, current state, we do not have any point of care ultrasounds in our primary care practices. We certainly have lots of providers who are interested and have been trained to do point of care ultrasound, specifically in our pediatric practice, but we do have some new practitioners coming into Middlebury that have had that training. So it's a matter of just kind of us catching up to the technology. So we have the desire, we have the trainees, we just have to get the technology and figure out the workflow. But yeah, there's huge value in that. And you know, we used to offer X-ray in our primary care practices in Brandon and in Virgins. We're transitioning away from that and certainly offering additional services, but that you know, adding point of care ultrasound actually might be a nice replacement for what we historically had to use X-ray for. So I think we'll get there, but we're not currently there.
That's great. And I can get my blood drawn at your practice. You wouldn't send me to Porter.
Yep, absolutely. So all of our primary care sites, you can get your blood drawn right there. So in two different forms. If you come to see me in the office and we determine you need blood work, we just have the medical assistants come in and draw that blood right there in the moment. We also have the ability of having what's called a nurse visit. So if, let's say, you needed fasting labs, you weren't fasting in the moment you see me, we book you a nursing visit for the next morning. You come in, you just see the nurse and they draw the blood there.
Yeah, that's great.
I'm going to stop the recording now, if you guys don't mind, because we're getting close to the end of time. So I'm going to hit the stop recording button.